So those are things that you can certainly pick up on. When we move into the abdomen, that's where all the organ systems really are that we try to, I would say, intervene more with. So understanding stomach and liver and kidneys and then bladder and intestines, all of that's in there, and that's where really learning how to palpate your cat becomes really important. Every single block cat that I do, and I do a lot of blocked cats, when they go home, so after they've been here for 3 days getting their urinary blockage cleared, they go home with one of the technicians, having spent time with them on teaching them how to give sub-Q fluids at home, how to palpate your cat and the bladder so that you know before you're hopefully ending up at the ER at 2 or 3 o'clock in the morning, understanding where just touching that bladder and the cat responding to you, understanding what's going on inside that bladder, and really palpating is hugely valuable and helps you kind of understand what's going on in your cat long before hopefully you end up at the ER. Some of these cats end up at the ER after being blocked for 2 to 3 days, and the prognosis is certainly going to be a whole lot worse if it's been 2 or 3 days before you've urinated. Constipation is something that happens in cats far more than in dogs, and every time I get a constipated cat, I will always say there's something that caused this. This is not, I think human beings have a lot more problems with constipation than animals do. And for every suspected constipated dog that I get, 99 times out of 100, it's a diarrhea and not constipation, because those dogs are straining and straining and straining, but cats get constipation more often. Usually it's a combination of they become too sedentary, and they're on a diet that's, primarily dry food. And a lot of cats suffer from a lot of things because we do a lot of dry food. It's convenient and it's more economical, but really cats are strict carnivores and they do much better with a high quality canned food diet. Everyone thinks that the dry food's going to do better for their teeth, but in general, we're really trying to get people on a high quality canned food. I kind of always describe it as every single cat thinks of themselves as this fierce apex predator. Like in their brain, they have to feel like they are, king of the mountain. So they need a lot of enrichment. They really need to be kind of working and exercising, and those constipated cats are happening because they're getting too sedentary and then their diet is too poor. Constipation happens most of the time in the older cats, and the urinary blockage is happening most of the time in the younger cats. So some of these diseases certainly follow kind of patterns, with age and lifestyle. I have quite a few patients who are in single pet families, and I think a lot of pets really do better in pairs. Nobody wants to hear me advise them to treat their kitten's problems by getting another kitten, but you either got to stay up all night and play all day and quit your job so you can stay home and play with them, or get a kitten for your kitten. And a lot of these things, these medical things, will hopefully resolve if they just have more activity and they've got more, someone to play with and stay active with. And then it's just kind of basic animal husbandry. So where am I on this list? We did eyes and nose and mouth and ears. The coat, I think a lot of cats, their coat will tell you. I see a lot of cats with bad coats simply because they've gotten too fat to be able to groom anymore. And they get mats kind of at the, back or the base of the tail because they just can't get to it anymore. So you guys don't have to look so guilty for so many things. But that's a lot of it, So some of these cats we just shave down once a year, and then it's time to get the catnip out, and it's time to get them, up and moving. Sometimes we use feeder balls. So if they really do love dry food, they've got to push the ball around the room to get a little piece of food out. And some of these cats, I say, that dry food is now delivered in kind of an obstacle course. You take it in your hand, you throw it across the room, and they've got to go hunt for it. Make them at least get off the couch and work for it. So there's a lot that you can do, but you have to kind of remember that what goes on in their brain is not always what's going on in our brain. And cats really do need to stay lean and muscular. Food will help, exercise will help, and then keeping them interested in things will help. Whether you put a bird feeder outside, some people use a laser pointer, there's now a million things on your iPad that you can do so they chase the fish, or get some little pesky kitten to run them around the living room a little bit and see if you can get them moving. I have some clients who will harness train their cats. You know, every cat's a little different, so I'm a little reluctant to push the harness training, but some cats really love to go out on a harness and will kind of sit on your shoulder like a monkey, and they go out in the world, and just getting them kind of out in the world is enough to keep them interested and engaged. We talked about body score, the spine and the tail. Mats are something that we see a lot of. If you get mats, we always want you to use clippers and never scissors. I don't care if it's worked 100 times, that 101, you're going to end up with a wound. So, you know, you can go to any of the big box stores and get yourself an at-home grooming kit. Respiratory rate is really important. The paws and the nails, we talked about that. Palpating the abdomen, that is something. If you are a client here, you can make an appointment in the Minute Clinic. So we have a Minute Clinic upstairs, which really is the place that we do nail trims and anal glands, kind of the quick blood draws, the vaccine boosters, and there's always one of our senior technicians is up there. So you can make an appointment to, you know, palpate a cat or bring your cat in and learn how to trim nails. For any of the older cats that are the kidney disease or the blocked cats, we teach you how to do sub-Q fluids at home. Learning how to do fluids at home, I think would save a lot of people a lot of overnight stays at the ER. A fluid bag here is like $20, and for most cats that will get you 10 doses. So if you're doing 100 mLs per day, there's 10 doses, and probably every single staff member here has done it with their own pet. And sometimes those acute vomiting or diarrhea cases can just go home with sub-Q fluids and try that for 24 hours. And for a lot of cats, that will be enough to kind of get them, you know, revved up and going again. So there's a lot that I think people don't recognize they can do at home for their cats. These days in cat medicine, there are multiple appetite stimulants. There's a whole slew of prescription foods. We have lots of options now for pain management that we didn't have before. There are long-acting antibiotics and analgesics. So these days we really can do a lot for these cats so that they can go home and get, you know, a day or two to see if that's enough to kind of turn them around before we are hospitalizing them or doing some of the what we call the advanced diagnostics, like x-rays or full blood work panels or even abdominal ultrasounds. Whisker fatigue, we talked, is important. Cats really should have access to fresh water. I think people underestimate the importance of fountains. At our house we have a lot of water bowls everywhere, and we switch them out and clean them all the time. Every cat sort of has their preference for where they get their water. Some of our cats are those kind of tactile cats, so they have to stick their paw in the water, kind of figure out where the surface is, and then you've got a dirty water bowl. It's like having a raccoon in the house, right? Like they have to wash all their, so really keeping those water bowls really clean is really important, and encouraging those cats to drink water is important, especially when, you know, the weather's like this. So you see a lot more upper respiratory stuff, allergy stuff, sneezing, coughing cats who look like asthmatics, and some of them probably are because it's so dry in our house, and nobody wants to admit it, but you know, certainly our house is the most polluted environment that any of us live in. And then when you add to cats that they're going to groom, so they inhale it and then they ingest it from grooming, and it just means a really high burden on them for for things like allergies and things that might further kind of trigger their breathing difficulties. Their natural cycle of hunt, catch, kill. They really like to think of themselves as being, you know, fierce demons. Activity levels. I think every cat's a little different. You know, certainly the kittens are more play, sleep, and it doesn't matter whether the sun is up or not. And then most cats, as they age, they're sleeping through the night and playing less at night and kind of back on our schedule. But having places where they can go, whether that's they need seclusion or they want the warm sunny spot. We live in an old stone house, and we have big windows, but those windows are cold. So I have two places where there's a heating pad. There's a heating pad, and I turn the heating pad on at night, and they get on that. And then I have a couple of cats who like a sunny spot with a cat bed during the day. So there's lots of options for them to go to. And sometimes it's just kind of understanding what their preference is. We had a cat that was brought in yesterday who is a outdoor colony cat, and that cat is just coming inside, needs to be inside because it's too cold, and she just needs a place to hide. And some of these cats really want a dark, quiet, way out of the way place to kind of acclimate and you know, kind of get themselves used to being inside. So bringing a new cat in, it's not always let them out in the house and let them explore stuff. That might be okay for the curious kids, but for some of the older cats or the cats that haven't had a lot of handling, they really need their own space on their own time. And here, for all the cats that we have here, all the cats here were throwaways or rescues, and they sit in a cage upstairs for about a month. We give them a month of just downtime because this place is complete chaos. So they need their own place where their food and their water and their litter box is. Most of the cats here were brought in because they were urinating inappropriately and people brought them in to euthanize them or didn't want them. So we keep them in a cage for a month to kind of reinforce, this is your spot, this is your house. No one's going to, you know, intimidate you or come at you, and then it reinforces. They have their own safe space. And at 5 o'clock every day, all of those cats are up at their cages ready for their dinner and their, you know, bedtime. And that's, you know, that works for them. I think a lot of people feel like, you know, they're being put in solitary confinement, but for them, those cats need to feel like they've got their own space, and when they're ready, then they can kind of be let out in general pop where all the rest of the chaos from upstairs happens. So it's always trying to understand what your cat needs versus, you know, they're very different than we are. Some cats are really outgoing and social, and some of them are just really introverted. And, you know, I have lots of people who have cats in their house that they've never had on their lap. You know, they're just not the cute, cuddly kind. And, you know, to each their own. Yeah, and then enriching surroundings, and that's really whatever works for you and your cat. And we're going to try to start having cat grass here. So we've got eggs from one of our staff members, and I think we're going to start trying to grow, you know, cat grass here. So you can come and, you know, pick up a new one. It really, for some cats, they really like to get in the dirt and have access to fresh stuff, and that really does help their digestive systems a lot. It's hard to get greenery in the middle of winter, especially if you're on routine normal foods. Okay, how are we doing for time? Good. Okay. What did I miss, or what do you think is curious? You are not allowed to ask questions.
So you went over the fluids and the fluid bag. I wonder how many people here have ever given their cat?
Who knows what I'm talking about when I talk about sub-Q fluids?
I haven't done it, but I do know that.
Okay, so subcutaneous, so we call sub-Q fluids is subcutaneous. That's putting a pocket of fluids underneath the skin in the area of the shoulders. That will usually give you 12 to 24 hours of fluids that the cats and the dogs can absorb, versus IV, which is intravenous, which is putting a catheter in the leg and then they're hospitalized. It's not apples to apples, but when the cost comparison is $35 here for sub-Q fluids versus $200, $500 somewhere else to be hospitalized with IV fluids, it makes a big difference, and then you don't need a fluid pump. So ideally for the blocked cats, we keep them on intravenous fluids for 3 days. So fluids going in while we're getting fluids out through the urinary system, but that's where the cost difference is. So that's the difference here, 3 days of IV fluids being in the hospital, even though we have to turn you off at night because we leave at 8 o'clock at night, is about $1,500. Most of the ERs are somewhere between $3,500, $6,500 for those 3 days. The real kicker is that some of those cats are going to reblock in the next week or month. So I've had multiple people come to me who are on their third unblocking, and they're $10,000 to $15,000 in, and it makes it, you know, the financial impact becomes really, really concerning for them. So we try to, you know, manage cost, but that's the difference between sub-Q fluids. So some of these people are on such financial constraints, or some of the cases are not so bad. Sometimes I'm getting a cat who's just about to block, or we're just getting the beginning of cystitis or urinary tract infection, and we can push them through with oral meds or injectable meds and sub-Q fluids. Lots of kittens who come in and their upper respiratory infection has gotten to the point where they're really dehydrated, and the sub-Q fluids can really revive them in just a very short period of time.
And it's very easy to do.
You've had good training.
What's that?
You've had good training. Yeah, it is. You know, it's those things that we can do as a demo in the minute clinic and in 20 minutes, and most people are comfortable. Sometimes we say, well, come back tomorrow and we'll help you, because we're usually doing it every 24 hours. So I have a couple of clients who come back for 2 or 3 days in a row for, you know, we'll do one and then we'll supervise one, and then they'll come in the third day and they have to kind of do it on their own, and sometimes that's
So you inject it?
it goes, we put a needle under the skin, yep. So we take a 1 liter fluid bag with a long line, and it goes underneath the skin, and we'll put like a hump of fluids on your back that slowly gets absorbed.
It'll look like a big swollen.
Wow.
Yeah, a camel.
It goes down pretty fast though.
Yeah, depending on, well, sometimes it's gravity. Gravity will kind of pull it down the leg, so sometimes that, yeah.
You have to hold the cat quiet.
You have to what?
Have to hold the cat quiet while you're doing it.
Yeah, some cats will tolerate it really well. Others need a little bit of what we call chemical assistance. So we'll use something like gabapentin, which is a pain management and analgesic. So sometimes we'll pre-med them with something so that they're a little calmer to do it. And some of these guys are so sick that they'll let you do it because they're just don't have the strength to fight back. That's, you know, a lot of the kittens, they get sick enough where you can do stuff on them that you won't be able to do otherwise when they're feeling better.
How do you calculate the body score? The numbers you.
So body score is just kind of a subjective thing. It's sort of understanding, you know, what do we think is ideal for this cat or dog. Some of it has some kind of breed guidelines, like the labs are supposed to be between 60 and 70 pounds. You know, we like to grow everything big in this country, so now it's kind of, we've kind of shifted that, but it's more a kind of a, you know, subjective thing. So, you know, some of the breeds or cats are naturally really skinny, so for them, we might call them normal at like a 2 or a 3, but for a normal domestic short-haired cat, that might be something like on the low end. So it's something that every vet kind of, you know, is a subjective thing.
On the scale,
Mhm.
I have one cat that's on the thin side.
Mhm.
She's been 9 pounds forever. She's the oldest. I have a younger cat who's just a little butterball.
Mhm.
Now, they get fed twice a day wet food, but then they're grazers though.
Mhm.
So I keep a dry food. They're on healthy weight science diet.
Mhm.
How much should I put in, and should I not fill it when the little chunky one is finished?
Yeah, so a lot of that really depends on kind of medical status. If everybody is healthy and we're not worried about a disease process, there is always in every household, there's always the cat who's got trouble maintaining weight and the cat who's gonna be, you know, nice and lean and muscular no matter what you do. So I don't typically micromanage it. If I'm worried that somebody's getting too overweight, where I'm worried about diabetes or we're worried about joint stuff, then I really try to switch them to a canned food. Like the diabetic cats are the best example. Diabetes in cats, for the most part, happens because it's a diet-induced thing. They really are carnivores. They really should be fed a high, you know, carnivore diet, and when you see diabetes in these cats who have typically been overweight, on a poor food, and sedentary. So I'm always trying to undiabetes them before we get to insulin. And for some of those cats, if you just remove the dry food and switch them to a canned food, you can resurrect the pancreas, which is
They
so.
get canned food twice a day.
Yeah. So
And I just tell there is.
yeah, but everybody has their own body type, you know, and we have 2 kittens. One's very skinny, the other one's really big. She's always been much bigger than her sister. She's the cat that goes outside with the dogs in the morning. Like she is, you know, she's like having a husky. Like she can go out in this weather. She never gets cold. Like that's just her. So, and sometimes you know, we're trying to manage it if we're worried about a disease process, but everybody is kind of within their own spectrum.
What do you think with caterwauling older cats? Like,
becomes increased. Like we have a 17-year-old cat,
Uh-huh.
and it's like picking up. He's constantly starting.
There's a reason.
to
He's,
howl.
in most cases, there's some disease process going in. It's either hyperthyroidism or it's kidney disease. It's probably kidney disease, although those two diseases like to go kind of hand in hand. When you get into kidney failure and your kidneys are not processing the toxins, it goes to your brain, and it's sort of like having an alcoholic in the house. Like there's just this degree of kind of delusion. They're also losing their sight, and a lot of them are losing their hearing. So I think for some of them, there's some degree of kind of cognitive dysfunction, but there's probably some disease process going on.
Yeah, because his appetite is fine. He's still doing zoomies. He's still cuddling. Like he's fine,
Okay.
healthy wise, but he's just
We always rule out the medical stuff first. So we
Yeah.
would do a blood work panel. For me, minimum database for that is a full chemistry, a thyroid, a urine, a fecal, a CBC. All of that gets, with a good exam. And then some of these guys need some behavior modification. My sister has a cat who will scream bloody murder all night because he wants another treat. So sometimes, we do a little bit of you get put in a cage overnight. We give you your stuff, and so that's behavior modification. But you don't want to do it until you've ruled out that there's not a medical thing going on. Yeah.
What's the sign of diabetes in a cat?
Diabetes in a cat, in most cases, is we're drinking a lot, peeing a lot, eating pretty well, but losing weight. Almost always, these are cats who have been overweight and then start losing weight. The classic presentation in veterinary medicine is called a plantigrade stance. So they start, instead of walking on their tiptoes on their back legs, they start walking on their hocks. So they're dropping in the back. So that's the first thing. It's, we check it with a blood glucose just like in people. So we do a blood test, and then we always check urine. There's a lot of advancement. Veterinary medicine has been very reluctant to admit that a cat is actually a species that we treat. They're just not as lucrative as dogs are. But in the last 10 years, there's been a lot of advancements. So now we have multiple options for diabetes in cats that we didn't have. It used to just be insulin therapy, and now there's a liquid and there's a pill available. I have quite a few cats on the pill version because that's just the brand that we carry, and they're doing really, really well. And a lot of people have been very happy to not have to do needles twice a day.
So like just pulling dry food from an obese cat might be a good idea.
You always want to, so cats always
Gradually.
Cats always have to feel like everything is on their terms. Like it always has to be their idea.
Yeah.
So you just start gradually feeding less and less dry food. There are diabetes foods, so friendly diabetes foods. So sometimes switching to those is helpful.
Thank you.
But it always has to be their idea. Never force the cat to make a decision they don't want to participate in.
They're stubborn.
Yes.
Do you have any suggestions on getting them to play?
Oh,
Why don't play?
well, no. I think there are some cats who are naturally playful, and there are some cats who aren't. Like it's, they're each their own individual being. Some cats just haven't found the right toy yet. I mean, we have a lot of toys here, and there are cats who really like the ball in the track, and then there are a lot of cats who really like the catnip toys. These days you can get like those treat packs that have or toy packs that have 30 different kinds. Sometimes they like the little jingle bell and the balls. Sometimes they like, and sometimes it's just giving them options so they can kind of tell you. And then, convincing them to be someone who they're not is just not gonna work. Did you have a question?
Yeah, we've got a very overweight 12-year-old cat
Uh-huh,
who's always been very lazy.
uh-huh,
And,
To watch us play.
yeah,
You're supposed to chase it.
when we had two cats, they'd split a 3-ounce can in the morning and a 3-ounce can in the evening. And because this stuff goes either bad in the morning or he eats it all,
uh-huh,
it's still 1 can in the morning, 1 can in the evening.
okay,
And he used to eat a lot of dry food. Now I guess since he's getting so many snacks, and in the evening it's like a 4 o'clock and then a 7 o'clock feeding.
I think you're confessing to your own problem.
It could be,
Okay.
but he's got us pretty well trained apparently.
Okay,
But I'm just curious. I know we should be, but I'm not sure what to stop.
So there's a myriad of options available for you for the treats. You know, if that's something that's important to him, I don't want to say take it away. But, you know, I really do like you can get the freeze-dried chicken. It's just chicken, it's just freeze-dried. There's like 0 calories in it.
He gets that at dinner time.
Yeah, we'll try to do it throughout your, you know, your day. And, you know, if you have to throw it and he has to go get it, you know, that might be helpful. I mean, there's, you know, trying to figure out what works for him. Some cats are just naturally sedentary and they just aren't gonna make the time to, you know, act like a kitten.
He likes to play while lying on his back.
Okay, well, I mean, burning calories and burning calories. You know, some of the cats really like the feathers on the kind of fishing line, and some
That's his
cats,
toy.
yeah. So it's trying to figure out what works for them and then adjusting your lifestyle accordingly, because that's what we're all here for.
Just like a wife.
Well, only the best trained ones.
What do you recommend for, so 2 of our cats have started kind of chewing on plastic, like the water bottle things recently. It's that's kind of increased too, or they're just, you know, it's mostly the plastic, I think, right? Yeah, it'd be big bags or not, or just.
No, I don't think they really do that.
Yeah, plastic. So we just got them these little, chew sticks that you kind of give them like a few times a week for like their teeth. But is there anything else you would recommend, or is that something you pay more attention to?
I mean, there's a whole bunch of diseases that cats get, like wool sucking, you know, tail tasting. I mean, there are a whole bunch of kind of, I don't want to say the word neurotic, but that's what it is. Like they're getting an obsession about something. You really have to be careful with plastic. We have numerous cats who just ingest hair ties, and you can't have a hair tie in the house. We've opened stomachs and gotten 20 and 30 hair ties. Like, why? You feel like you have to swallow it. Linear foreign bodies, so string and needles for some cats. You know, it's trying to understand, is this a behavior that is about curiosity? And if so, is there the chance that this can lead to a medical emergency? And then trying to thwart it before it becomes that. You know, I think like any animal, boredom can lead to just bad decisions. So you really just got to kind of figure out. And, you know, I mean, probably the better example is people kind of go crazy with dogs putting their mouth on something. You know, they don't want them to chew, they don't want to put it. Well, being a puppy means they taste the world, like the way that they investigate the world is by tasting it. It doesn't mean they're going to get aggressive and bite. It doesn't mean, but feeding your dog bones repeatedly or chew toys repeatedly so that they won't chew your toy, you know, your shoes or your clothing or your house, like that's a dog who needs to kind of be redirected from boredom. You know, so go out for a walk or go play. Try to redirect onto something that's a little bit less dangerous. You know, chewing plastic for cats or the linear foreign bodies, like that's where it gets to be. You know,
yeah, because they're not swallowing it or anything. It's just that. But we also don't give them dry food, so I think they're just looking for something, maybe a crunch or something like that.
Well,
so.
yeah. I mean, maybe try the freeze dried. Maybe a mitigating way to address that is try the freeze-dried protein stuff, which is a little bit harder and a little bit crunchier versus always that, you know, moist and gravy kind of stuff, or catnip or something. But yeah, chewing plastic makes me, because some of them will chew plastic bags, and that's, yeah.
No, that's not our pet show.
Yeah.
So. Thank you.
Yeah, of course. Okay, anything else? Okay, who's gonna go home and start working on your organ systems and your muscular? There you go. That's what I love. Okay, yeah. I think a lot, just going and picking up your cat. Like for me, I know how much a cat weighs just by picking them up, and I can kind of track my cat's aging process by, you know, how much they weigh in my hands. You know, and that's a really great way for you to kind of pick up on the subtle clues, because cats are really secretive. They really just make you work hard.
So with the matting, we tried, our cat,
He has really bad dandruff too. He tries his best to clean himself. It's not from dry food, it's not overeating or anything. He's just a big cat. He's 18 pounds. And it's not like he does clean himself. He tries his best. Like I said, he has little fat pads. But he's still constantly getting matted and he has dandruff. We brush him and everything. It's just constant.
You can try omega-3 fatty acid, and sometimes the fatty acids will help. And then, you know, try to add more moisture, and then I do think kind of, grooming, and that will help. But it's probably more related to your obesity than it is your diet environment. Yeah.
And they have cat grooming kits, is that what you're saying before?
Well, the grooming kit that I was talking about is just like shavers, like those little clippers, so that you're not cutting mats out. It's the electric shavers.
He has some, so.
Yeah, I really love the flea combs with the metal tines, just
Yeah.
those are really helpful. Yeah.
Okay, all right.
Do you recommend any plants?
Yeah, some cats really love them, and there's a whole bunch of not so safe plants and a whole bunch of safe ones. So I really think cat grass is probably the easiest way to go. It's super cheap. You can get the organic kind. It's, really easy to, it takes like less than a week to propagate, and having that out, and you can do big ones so they can actually kind of get in and, play and roll around in it. Yeah,
The scratch pads, right now we have the corrugated
cardboard ones.
But I've seen those other ones, it's that other material, so it doesn't shred. Are those any good, or?
Some cats really like them, some cats don't. I mean, a lot of my cats really like these kind of coir mats things. So
Okay.
whatever you want to make yourself, and I don't really know why people buy them, but that's just me. Anything to kind of get your catnip is really undervalued. It's so cheap, you can get it anywhere, and just putting it on a piece of cardboard and laying it out.
Okay.
Yeah.
Okay.
Or you can buy the fiber and wrap it around a pole and make it yourself, and even just having people will bring logs in, and anything for them to just kind of scratch. It doesn't. I always worry a little bit about buying something that you're cardboard is everywhere. Kind of make it yourself and just put enough catnip in it to get them going, and then it's bleached and it's processed, and then they eat it, and like that kind of stuff. So I'd
You
rather
say
just
a piece of cardboard with catnip, not even like.
and you can get any cardboard that you've got, and you can just take a knife and kind of make slits in it,
Okay.
and then put the catnip in it.
Okay.
There's a million different products too that you can kind of put on it, but any of the natural fiber stuff, you just have to be careful, because a lot of it gets ingested accidentally or otherwise. So that's where I'm sort of like some basic dirt and some cat grass.
And
What
you
do-
said,
No, go ahead.
you said that you could show us how to clip nails?
I'm hoping that one of the staff members, that will be one of the things that they do. The problem's gonna be a willing participant, so.
What exactly does catnip do to a cat?
Oh, I don't know.
Yeah, it's
don't
like,
know
I
the
kind of
genetics
almost feel
of-
bad giving it to them sometimes. Like, I don't know what it's doing to you.
Oh, I don't think it's doing anything bad.
Okay, cool. I mean, they seem to love it.
Yeah.
I'm just like, what
Yeah.
if they?
I mean, we
don't-
use it a lot for those cats that were struggling to get eating again, or acclimate to
Yeah.
being in the hospital, and
Okay.
it's really, everybody should get it for Christmas.
You're not gonna hurt anything giving it to
Yeah,
them
no.
whenever. Because my friend grows it. She
Yeah.
just gives me stalks. I just
Yeah.
give it to them.
Yeah, that's a
They
good
like to
friend.
roll on it.
They love it.
Oh my
Okay.
gosh, they do.
Yeah, just roll
The
around.
little kangaroos full of them, they just,
Yeah.
they hold on to those for cheap.
They make a spray that you can like revive toys with too.
Well, I have a
Really?
spray, and it worked a little bit, but then they just kind of ignored it, so.
Probably the best, you can go to Goodwill or one of the, and get baby socks and just put a little bit of stuffing in with some catnip, and they're so cheap and disposable, you can just, So that's get a little cotton sock or something, or,
I also just take a plastic bag and put catnip in it
And
and
then-
put my toys in it for a couple days and shake it,
Yep.
leave them in there, then bring them back in.
kind of revive them.
Revive
Yeah.
them.
Might be cleanup time upstairs. All right, so we will keep you posted on Facebook is really what we use. So we'll try to, we're trying to do every 2 weeks. I'm trying to kind of, build an army of volunteers who are dedicated to blocked cats or helping people. Like, I'm really hoping that we can create this kind of community support so that somebody who's in a predicament with a cat can phone a friend and get some help to, kind of keep paying it forward and passing it along. I really think that we can do a lot for the advancement of compassion and care and better care and kind of working within a system that's getting increasingly unkind, and that's how we do it. Okay, thank you for coming, everybody.
Thank
you.
you,
all.
it's awesome.
This is Erica. She really helps, helps keep my whole life in order. So if you call and you email, she'll probably be the one that responds back to you. So she's helping organize all of this.
You put up like another sign like you did for
Yeah,
this?
we will.
Okay, cool. Awesome. Thank you.
Yeah, of course.
All right. I'm also going to get dishwasher balls. All right.
Oh, Erica is the date with Seraphina. She's trying to.
I can't figure out.
What are you trying to do?
Turn this off.
Oh, it doesn't really like that.
I'd like to end the. Oh, yes, and streaming.